So today what we have here is talking about the ciliary ganglia. Well, see, meaning the ciliary ganglia look like that. Ciliary is a 3, so the 3 is a 3. When the third cranial nerve is oculomotor, and oculomotor look like the same word of the construction. So the oculomotor nerve, the function of it is construction. So a parasympathetic root of the ciliary ganglia is from the oculomotor, and which specifically type of the oculomotor is inferior oblique. What about the sympathetic is from the internal carotid and sensory root? A sensory root is from the nasal ciliary. Ciliary, why? Because the ciliary, we're talking about the ciliary ganglia. And just by adding the nasal, we will have the sensory root. What about the branches? Ciliary ganglia. Ciliary ganglia will have a sheer ciliary nerve. Why? Because ciliary ganglia is a parasympathetic ganglia, and the parasympathetic ganglia, the postganglionic, will be sheer, not long like the sympathetic. So we called it sheer, not long, and ciliary ganglia, ciliary nerve. Okay, we said that the parasympathetic have an oculomotor nerve, specifically type is inferior oblique. What about the branches of the ciliary ganglia, the postganglionic? Well, with the postganglionic and the parasympathetic, we will cause a constriction to the something of the eye. What could be the muscle that is responsible for the constriction? The first will be a sphincter babuli, and the other is the ciliary muscle. This is the muscle, ciliary muscle. When you talk about the ciliary muscle, just imagine that we have a constriction, oculomotor, a constriction, and ciliary. As also we have the ciliary, which meaning constriction. So we'll come to the postganglionic sympathetic, and postganglionic sympathetic will cause also constriction. But this will be to the blood vessels to the eyeball and sensory to from the eyeball. I think this is helpful, will be useful.